Hey, I'm Brooks Higginbotham, LCSW, and welcome back to our 5-part series on cognitive distortions. This is part number 3, and we're starting with number 7, which is disqualifying the positive. Now, what does it mean to disqualify? What does it mean to be disqualified? So if you look at professional wrestling, then you've got a situation where you would get disqualified by using a foreign object, by doing something outside of the rules. You would no longer be qualified to participate in that matchup. So that's what disqualification means. So disqualifying the positive would mean the positive things that happen in my life are no longer qualified to enter my brain. So getting rid of anything positive that happens and only focusing on all negative things. So let's say that maybe a light ended up falling down on the ground, and I looked at that and I thought, man, I don't want to have any lights overhead anymore. They fall down all the time. They do this, they do that. Well, you're disqualifying the positive things that happen. You know, they provide light, they look good, they do all these different things, and you're only focusing on one specific thing that happened one specific time. You're disqualifying the positive things that could happen. Now, that's kind of a mundane example, but still, the logic still exists in regards to that. That's number 7. Number 8, after disqualifying the positive, we have black and white thinking. Black and white thinking, also referred to as all or nothing thinking. So there's an old adage that nothing is black and white, which is actually a black and white statement. And then everything is in shades of gray, which is actually a black and white statement. Sometimes it's really difficult to get around black and white thinking, but that's looking at something as all good or all bad, or all this or all that. And looking at things like that is part of compartmentalization, so you can break it down and so you can understand it, so you can be prepared for something so it doesn't hurt you, so it causes less anxiety, so it causes less depression. PTSD-related symptoms are much less than they would have been. That's why people engage a lot of times in black and white thinking. You have to challenge that by looking at the gray in these situations, by saying it's not all this and it's not all that. This is where some overlap is. This is where these other things. So coming in with different evidence and challenging those things is extremely important. And then last but not least on this one, number 9 is personalization. So what is personalization? I feel sure that everybody out there's seen these big old Stanley cups that people are carrying nowadays that are as big as a house. So you grab one of those and maybe you get it monogrammed. You want to personalize them. This is my cup and I'm going to drink out of it and everybody's going to know it's my cup. So that's what it means to personalize something, is to actually put your stamp of approval on it so everybody knows that it belongs to you. Take that into the mental health world. To personalize something is to take all of the blame and to put your stamp on it and blame no one else for it. It was all me, I was the entire problem, I did this, and I'm taking all the blame for that. People do this, and it's a shame-based behavior, so they can control the situation. We personalize things and we say, I'm taking the blame for all these things. That way they can control things and they can control the outcome. Very, very few things are all me or all someone else. Once again, that's a black and white thinking. That's called personalization, when we take all the responsibility for something because we want to control the outcome.